You know, I've said it so many times that I think I have the best job in the world because I get a chance to meet interesting people and speak about incredible things. And our next guest is a Jamaican native who became the first person in the United States to receive the COVID-19 vaccine and the first person in the world to receive the kind of vaccine, that's when it was Pfizer, and is the winner of the Presidential Medal of Freedom, the United States Presidential Medal of Freedom. And I'm speaking about the author of a book called First in Line, how COVID-19 placed me on the front lines of a healthcare crisis. Dr. Sandra Lindsay is with me. Good afternoon. Welcome.
Good afternoon, Neville.
It is amazing to meet you. How are you?
I am doing well. I'm a big fan of the show, big fan of you and Simone.
Thank you so very, very much. Before we get here, just remind me quickly of what was happening in Jamaica, why you decided to get up and left us a long time ago.
Nothing was happening in Jamaica, actually. I loved my life here. But, you know, parents, my mom was immigrating to the U.S. And so, you know, I was 18 years old and she took me along with her.
Yeah, you said healthcare has always been your passion. Where did that come from?
Well, I grew up with my grandmother, my grandparents, but my grandmother had the chronic illnesses, diabetes, hypertension, glaucoma, you name it, she had it. And I took great pride in taking care of her and seeing how she flourished and thrived. She was a school teacher and a leader in the community, and so that inspired me. Moreover, I loved to see the nurses in their white and the cap, and it commanded such respect and attention, and I wanted that. Moreover, it's a noble profession where you get to make a difference in people's lives, and I wanted to do that.
Beautiful. In the book, you tell us about going to the Bronx. You worked in a grocery store. What was it like going to the United States, coming from Jamaica? What was that like?
So one of the chapters in the book talks about privilege to pauper. And I felt like when I went there, looking back, I had such a privileged life here, growing up in Clarendon, Palmer's Cross, shout out. And going there, it's like starting all over again. I was working less than $4 an hour, standing on my feet for 10 plus hours a day, being disrespected. But you know what? I had a vision for myself and for my life. So this was just part of the journey to get there.
Yeah. I didn't want to get here so quickly, but because you mentioned being disrespected, in the book you say, with all that you've achieved, you still face obstacles. Like what?
I'm still a black woman in America, right? I'm still a black woman in America. I faced discrimination when I went in to have my son. Nobody listened to me about the pain. Profanity was used to me. Back then, I was in my supermarket job, and I didn't have health insurance, so I was using the public health system. But even with all that I've achieved, I'm still a black woman in America.
Yeah, and you also say, though, that you don't see yourself as a victim.
No, not at all. I never see myself as a victim.
You take the high road.
Yeah, because when things happen to people and they say, oh, Lord, why me? Why not me? Maybe I'm better prepared to deal with whatever it is. Yeah. So I always, take a moment to digest what is happening, and then I'm looking for solutions. Yeah,
the last time we had anything as horrific as what we had with COVID-19 was back in 1912, I think. And you said also that you saw so much suffering, so much death. What did that do to you?
Mentally, it broke me down. It broke me down, and still I get triggered. But when I sit down and I remember what we went through, it was very hard. It was devastating. Words cannot express how devastating it was. Okay. And you know, my now 30-year career and over 20 years in leadership just could not have prepared me for what we went through.
You said the pandemic exposed weaknesses in the American government. I understand that. The public health system, I understand that. And you said the media. Why the media? What did you notice? What kind of weakness was exposed with the media?
Well, I think we could have done better with the communication. The communication, not creating so much hysteria, but instead focus on educating. And educate in a way where everyone understands, not making it so, not sensationalizing it so much, but, you know, really breaking it down for the public, with the intent to really rally up everybody behind solving this problem. We're all in a crisis, and so we're all in this together. It's not us versus them. It's all of us.
I just want to know quickly before we go, why you decided, I think her mic is a problem, so we're going to go for a break and come back. All right, folks, we apologize for that break in transmission. Dr. Sandra Lindsay is still with me. She wrote the book First in Line, as you can see there. How did you feel? And were you asked to take this, or did you just put up your hand? Because I remember saying, I said, if it came to Jamaica and I think it can save my life, I said, I will take it. But were you asked to do it? Did you just put up your hand and say, I want it?
I volunteered.
Why? You were nervous?
Not at all. I was actually more afraid of getting COVID and dying than dying from the vaccine. So in my role as a nurse, I take a professional oath to protect and serve my community. And I saw that, when I was rolling up my sleeves, I was fulfilling that oath. Also, as a American, as a citizen of any country, we're in a crisis, and it's all hands on deck.
We need leaders. We need leaders.
And then I wouldn't ask my staff to do anything that I wouldn't want to do.
Fantastic.
Moreover, Neville, what I saw were people that look like me, that were suffering the most.
Right.
And I know that they were less trusting. And it was my way of instilling public confidence in the safety, of the vaccine.
How did a little girl from Palmer's Cross feel when she was given the United States Presidential Medal of Freedom?
I felt so proud. I was grateful. I stood there and I just let it soak. I just soaked it all in. But I wasn't just proud for me and grateful. I was proud for everyone that I identified with. Jamaican, Caribbean, a woman, a black woman, a nurse, an immigrant, because there was so much negativity around immigrants around that time.
Even though,
So I just stood tall and proud.
So when you get the car, you never say, oh, no, stop ramp with me. You never hang up the phone.
Exactly. So I thought it was a prank call because I missed the call the first time. I was at a conference and on a panel, and the message was, the President of the United States, President Joe Biden, would like to know if you have some time to speak with him this afternoon. And I go, yeah, right, the president. The president has a whole country to run, wants to talk to me. But then I consulted one of my friends and PR advisor, and he said, well, if it's so, you should get an email. So look in the email, and there it was. And
Brilliant.
When I called back and they confirmed it, I thought I was just going to pass out.
Brilliant. I'm so impressed.
Thank you so much.
Congratulations. Great to have you with us today.
Thanks.
I love you.
I love you more.
Blessings.
One love.
Blessings. Author of First in Line, How COVID-19 Placed Me on the Front Lines of a Healthcare Crisis, Dr. Sandra Lindsay. 1 second. Where can we get the book?
So the book is available on Amazon and Barnes & Noble. And I will be at the Pegasus this evening between 6 and 8 signing books. I have some books for sale. But if you have your book already, you can bring it by, and I'm happy to sign it.
Beautiful. God bless you and your family.
Thank you.
A safe trip back home.
Thank you, Neville.
Sit with us for a while. That's it for Off the Shelf.